And right now on KPIX 5 and streaming on CBSN Bay Area, more local news at 5:30. The first case of the new mutant strain of COVID-19 has now been detected in California. A man in his 30s in San Diego County with no travel history is infected. Health experts are expecting more cases to pop up soon.
Because there is no travel history, we believe this is not an isolated case in San Diego County.
Good evening. I'm Juliette Goodrich.
And I'm Ken Bastida. Governor Newsom first made the announcement about the new COVID strain during a virtual conversation with Dr. Fauci. KPIX 5's Wilson Walker is live in Walnut Creek right now with a little more on that topic. Hey, Wilson.
Yeah, Ken, they kind of got right into it right off the bat. The arrival of B117 here in California. They also talked about when people, just regular, normal people, might be able to walk down to a pharmacy, get themselves vaccinated. And they also talked about when all of this might finally be over.
Well, Governor, first of all, I'm not surprised that you have a case and likely more cases in California. And we likely will be seeing reports from other states. Colorado.
Calling it an expected development, Dr. Fauci urged calm regarding the new variant's arrival, stressing there is no evidence it is more virulent, just more transmissible. More importantly, he says the new strain has the same weakness as the normal one.
It doesn't seem to evade the protection that's afforded by the antibodies that are induced by vaccines.
And Fauci went on to give an update on the country's effort to get the vaccination process up to speed, acknowledging that the early pace has been slower than he had hoped. But he said he spoke with the general in charge of the operation today, and he's confident things will improve.
In any massive undertaking, like the initiation of a massive countrywide vaccine program, you're going to get some bumps in the roads and some hiccups. As we get into January, the feeling is that we're going to gain momentum to be able to catch up.
Which leads to the big question, when will the public at large be able to get vaccinated at will, say, at your local pharmacy? Well, that is still probably about 12 weeks away, think springtime. Based on that timeline, Fauci gave his latest thinking on when the pandemic might wind down.
I believe that if we do the kind of vaccines through April, May, June, July, that by the time we get to the early fall, we will have enough good herd immunity to be able to really get back to some strong semblance of normality.
Yeah, Wilson, I'm wondering, does Fauci think there's anything that we can do to actually speed up the timeline to get this to the regular normal person a lot sooner?
I didn't hear anything like that from him. If you listen to what he said carefully, to me at least, he sounded like he was describing the best case scenario. Like if we get up to speed and we get the public at large vaccinated in April and starting then, that he is calling fall the finish line. I'm sure there's people sitting at home who heard that and dropped their dinner or something, but that is still the pace and the timeline he is working on. Spring for the folks at large, and then maybe fall.
Been a long 10 months. A long, long way.
Yeah.
All right, Wilson, thank you for that.